Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Uganda has made great improvements towards fighting HIV/AIDS as a public health threat, at least according to a recent fact sheet based on data ending 31st December 2020. It is among the 8 countries in the world that had fully achieved the 90-90-90 targets by the end of 2020, the others being Eswatini, Switzerland, Rwanda, Qatar, Botswana, Slovenia and Malawi. The number of people living with HIV increased from 1.2 million to 1.4 million. There was a drop in new infections by 60% between 2010 and 2020 from 94,000 people to 38,000. However, the Director General of the Uganda AIDS Commission, Dr. Nelson Musoba, says the new infections per year are still too high.
For instance, over the last 10 years, we've seen a reduction by 37% of new infections. But in 2021, we still had 54,000 new infections.
And the young people, particularly girls, are majorly affected.
Females had 64% of those infections. And we see the young people taking again proportionately higher, about 3 times of the new infections are young people. And even amongst the young people, 15 to 24, 4 out of every 5 new infections was a girl.
Dr. Musoba says it's a concern, but where is the missing link?
It points to a number of things. One is that it's possible that the messages being given out are not reaching the young people. The Ministry of Health study also found that young people, although the age for first sex had improved slightly, with the girl child having first sex, the sexual debut, at 16 years, the boy slightly later, it's still a bit low because you want them, that's on average. Of course, if you go into the population, you'll find that in a number of them, it's occurring much earlier than 16, depending on where they are.
Charles Owekmeno is the country director at Sexual Reproductive Health Rights Alliance Uganda. He says there needs to be a thorough evaluation to establish new ways of tackling the problem at hand.
Information. Most of these young people are having early sexual debut. They have not gone through any form of sexuality education. They're experiencing body changes. They don't know what is the implication to them. And they're engaging in risky sexual behavior as a form of fun for them. So the critical thing that we need to do is make sure there is access to information, right information for young people. And this we need to do it in so many ways. For the government side, we need policies, especially the implementation of the National Sexuality Education Framework. Because this is where we will make sure that in every school that our children are going to, they have information. They are being taught and given the right information. But also, we have to make sure that everywhere where young people are being brought up is a source of information on their sexuality. Whether they go to school, the school should have programs for giving information to young people. When they are home, the parents need to be capacitated to deliver the right information to guide their young people on how they can keep safe.
This seems to be a cross-cutting issue. Dr. Musoba says some studies have since established that a section of young people do not fully understand the available information.
When the Ministry of Health study interrogated people to find out their comprehensive knowledge about what HIV is, how it is transmitted, and so that, because it's only when you know what it is and the risk factors that you can protect yourself. It was found that the knowledge about HIV was fairly low, close to 40% of the respondents didn't know correctly, how HIV is transmitted.
The experts say the change in trends, especially the availability of treatment for HIV, has given some young people false confidence.
All the leaders were providing information, including the president, we were using pictures that were so touching and people would really pay attention. Everyone you speak to will tell you and warn you about HIV and AIDS. That context have changed now. One, we already know that now people living with HIV are like any one of us. They can be healthy. So it means that the protection is no longer about what you see, but you should know that there are protection procedures that you must follow. For example, testing and knowing your HIV status, using condoms, and being faithful. Whether you have seen that someone has the signs and symptoms of HIV or not, you have to follow those procedures.
Both Owekmeno and Dr. Musoba say they are now working with young people to deliver the desired messages to their peers.
But also working through art, work with the artists, work with the musicians, work with the comedians. Not only are they in their age group, but they can communicate this message in the way that young people relate it. But also we are going back to focusing on the ABC. In addition to treatment, of course, we know that treatment, adds a lot. It is prevention in itself when used well, but ensuring that we tell young people that abstinence is still important until the time that they are ready for the consequences of sex. And once they are ready and they have their partners, they need to be faithful to those partners. And should they find themselves in a situation where they need to protect either themselves or their partner, either as a result of discordancy or because they don't know the HIV status of the other partner, then they need to use a condom.
By 2021, there were 1,109,120 people on treatment for HIV and AIDS. Of these, 725,024 were women aged 15 years and above. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in your